I delivered Dylan and Cole at 34.5 weeks. You anticipate having your babies and being able to take them home. So it was definitely a change in my plan, and I just had to adjust, and the NICU staff really helped with that.
We work as a team here in the NICU. We have obviously the NICU nurses. We have 24/7 in-house neonatology to provide round-the-clock care for the babies as well. We can provide really excellent care. It's very individualized.
They were really good with me, trying to comfort me and talk to me. I could call whenever I wanted, and they were going to help me out. They were able to teach me how to care for preemies, because it's totally different than a normal 9-pound baby or 8-pound baby. Walking in and holding a little baby like that big, I didn't even know how to change their diaper.
Parents are really the primary caregivers for their babies, and we help them to become comfortable. Parents are holding their babies skin to skin from that very first day, or holding and swaddling and rocking like I'm doing now with this little one here.
Matthew, his big challenge was feeding, so I did a room in the night before we came home. So I spent the night with him in one of the postpartum rooms, and they had equipment set up in case something happened, but I went and checked in every 3 hours and got a bottle to feed him, and the next morning they weighed him to see how he did overnight, and that was our big determining factor, that he was ready to come home.
The joy of neonatal intensive care is a very special one. When a baby comes in born early, it's a very difficult time for the family, and it's a very stressful time. But when the baby gets discharged and goes home, it's a very happy occasion.
I think that we just love what we do. I love being a nurse, and I love what I do every day. I feel like I make a difference in people's lives.
Not only as a nurse, but as a woman and as a mother, we look at the needs of these families and we take them seriously, because that is what family-centered care is all about.
People have asked me, and I've told them, that my experience at the Loudoun Birthing and NICU was perfect, and I felt very comfortable in their care.
Many of our parents who have had a more complicated birth may experience the expertise of our team and our Level 3A neonatal intensive care unit. We want you to consider our hospital not just for the physical comforts, but for the emotional comfort of knowing that should you need it, we have the expertise to care for you and your baby who require extra special care and attention.
This is classified as a Level 3A NICU, so we're able to take care of all babies who are more than 28 weeks gestation or more than 1 kilo, which is just about 2 pounds.
The designation requires that we provide specially trained dietitians, social workers, case managers, respiratory therapists, and we have that all in-house.
For moms in the NICU, breastfeeding is a different experience for them. We get to them early, get them started pumping. We also are available to them at the bedside, so as soon as their baby can start breastfeeding, we're there to help them.
The first time we attempted breastfeeding involved a nurse, a lactation consultant. I started calling breastfeeding a team sport in the NICU, because you don't do it just by yourself.
It was great to have that support. It was something that I wanted to do, so they set me up where I could pump. They even told me, the nurses told me I could come and pump right there at the bedside of my babies, which was great to have that time.
We also have some supplies, pretty much anything a nursing mom would need in the first weeks of breastfeeding. Many times after patients are discharged, they do come back to the lactation center for a private consult with one of our lactation consultants.
I knew where they were, and it was easy to pick up the phone and go see them.
There are 4 programs in the state, and 2 of them are through the Inova Health System. I work with the physicians and the nurses to ensure that the families have a smooth ride from their point into the hospital admission until after they go home.
Christine walked through with me what most parents find very alarming and scary when they first walk into the NICU. So she explained to me what we would probably see the first time we saw him, and things that usually get parents really worked up. She explained ahead of time so that when we saw them, they weren't as alarming to us.
With the partnership with the March of Dimes, we do get printed materials that are all about prematurity, orientation to the unit, equipment that's used, and what's nice about that is that they are both in English and in Spanish.
We really offer very personal attention. We really get to know our families and our babies, and we really love our families and our babies.